everybody. I wanted to take some time to do an update for everyone on the tests that I've had done recently and how they've been going. So the most recent test that I had was my natural killer cells blood work and my saline sonogram, which is just a fluid ultrasound. So the saline sonogram I'll talk about first. That's done in the office with the doctor, and they basically do like a pap smear, but they inject saline solution into your uterus to see if your uterus has any polyps or lesions. And luckily, mine does not. So that was nice to hear. But again, still, we were wanting some answers. So the fact that everything's been going so well was almost frustrating because we wanted to find out what was causing the issue. So it was nice to hear from the doctor today, and they called about my natural killer cells blood work, and I am positive for that, which just means my natural killer cells are activated. So what that means basically is that my immune system is too good, and anytime that I implant a child, basically it will kill it. So basically your killer cells are too good. They think it's a virus or something like that. So what I have to do then is anytime that I get pregnant or start treatments, I will have to have a transfusion that's done via IV. It takes about 2 hours to make sure that they deactivate those killer cells. So the hard part with that is, let's say I get pregnant at home, and well, of course you get pregnant at home, but if I find out that I'm pregnant naturally without any intervention from treatment, then I would have to go to the doctor literally like that day to get that transfusion in hopes that it will prevent any issues with the child implanting or continuing to implant then at that point. So it may explain why we've had 2 miscarriages, and hopefully we'll be able to go forward. The downside to this is that I will have to do that anytime I want to have kids, or anytime that I find out I'm pregnant, and then every time we do a treatment. So if I go further with IUI or in vitro, then I will have to have that transfusion done every time. So that's slightly frustrating, but at least it's starting to give us answers, which of course is what we wanted. So I was excited to have something that was said, yes, this is an issue, and here's part of what the issue is, so where do we go from here? And so that was nice to have. Now, the nurse did basically tell me that we're still waiting on the rest of my blood work. So all the blood clotting disorders and all the chromosome analysis that we were waiting on is still waiting to come back. So I'm hoping that we'll have some more information around that soon. So far, a couple of updates would be that I do not have PCOS, which is what I've been diagnosed with the past 5 years, and I've been living with and treating because that's what I've been told I had. Little frustrating because it makes me not trust my OB that gave me that diagnosis. Luckily for me, my sister-in-law is a labor and delivery technician and knows all of the OBs in St. Louis County that work through Mercy Hospital. So her and I are going to sit down here soon and figure out what doctor she thinks is going to be best. And I'll get a chance to go meet some of these doctors and be ready for a new OB when I do get pregnant. So that was a little frustrating considering I've been treating that for over 6 years now, and we've been blaming that for our infertility for the last 3. Dan's semen analysis came back, and everything's perfect for him. Everything's actually really good for his. So, of course, it's me, not him, which, if you know my husband, you know that he loves to remind me of that. But it's, yeah, where we go from here. So I will keep you all updated. As many of you know, Thanksgiving is a very hard time of the year for me because it's the time last year that we lost the baby. So thank you all for your outpouring of support. It's been wonderful. I've been totally floored by how many people have reached out and continue to reach out. So I appreciate that. I hope you all have a wonderful Thanksgiving, and hopefully by Monday I will have more to update you on. Talk to you all then. Thanks.